Permanent Secretary, Dr. Jacqueline Biseso McKenzie, Chief Medical Officer, Mr. Ian Stein, the PAHO WHO country representative, Dr. Karen Webster Carr, National Epidemiologist, Dr. Simone Spence, Director of Health Promotion and Protection Branch, Dr. Nicole Dawkins Wright, Director of Emergency Disaster Management and Special Services, and Dr. Nadine Williams, Director of Health Services Planning and Integration, as well as other members of the technical team. So good morning, everyone, and thank you for joining us. At this time, I'll turn to the Minister for his presentation.
Thank you very much, Stephen. Are you hearing me clearly?
Yes, sir.
Okay. All right. So good morning, everyone. Good morning, colleagues at the head table, distinguished ladies and gentlemen online. So thank you for joining us. Today's press conference is to announce that Jamaica is now experiencing an outbreak of leptospirosis, with an increase in the number of confirmed and suspected or probable cases reported across multiple parishes over the last week. The outbreak follows the passage of Hurricane Melissa, which has created conditions that have increased the risk of exposure to contaminated water and soil. Leptospirosis, as we informed the public during our meeting, Let's Talk Recovery series on Sunday last, is a significant public health risk following heavy rainfall, flooding, or any major disaster. The bacteria that causes this disease thrives in water contaminated by urine of infected animals, especially rats, but also cats, dogs, and livestock. Leptospirosis can affect anyone who comes into contact with contaminated water, soil, or mud. That includes farmers, persons engaged in cleanup activities, emergency responders, and others navigating flood areas. The meeting last evening with my team confirmed that there are 9 cases that are confirmed, 28 suspected or probable cases. And these numbers are from October 30th, 2025 to November 20, 2025. The numbers reflect significantly more cases than the 2 to 21 cases observed in the preceding 34 months. There have been 6 deaths from among the suspected cases. There are no deaths from among the confirmed or probable cases at this time. 8 parishes have confirmed and or suspected cases: St. Anne, St. Mary, St. James, Hanover, Westmoreland, St. Elizabeth, St. Catherine, and Trelawney, with additional reported cases under investigation. I want to just make it clear or set the context for how cases are actually declared. Declaring an outbreak is important because it enables, declaring an outbreak is important because it enables a country to activate a faster, more coordinated public health response. An official declaration signals to the health system that immediate action is needed to identify cases, to contain the spread, and to prevent severe illness or death. In fact, there's a requirement once you have an outlier event in terms of the numbers to actually declare. It also unlocks resources such as surge staffing, diagnostic supplies, and emergency funding, and strengthens national surveillance so that cases can be detected, treated, and monitored more efficiently. So this early coordinated approach helps to limit the scale of the outbreak and reduces pressure on the health system, and hence why we are here today speaking to the public. A declaration also supports clear communication and transparency with the public. The ministry is therefore committed to continuing to issue accurate, timely message about risks, symptoms, and steps individuals and communities should take to protect themselves. This should help to counter misinformation, build trust, and encourage our people to seek care early. The declaration also strengthens collaboration with our partners, local and regional and international, allowing for the quick mobilization of technical support, supplies, and expertise. So while we are not, this is not an indication of a panic, or certainly not encouraging anyone to feel get into a state of panic. It is a requirement for us to speak about this. It is something that can be managed, can be controlled, can be treated, and beyond the normal numbers, we have to make it known, and we are making it known so that the public can be informed and the measures to be taken can be outlined, which includes their own personal responsibility, which everyone has to take, particularly in these circumstances after a major event such as Hurricane Melissa. The response as a government to this declaration, therefore, must be multi-pronged, multifaceted, drawing on the capacities of multiple local agencies and international agencies. So let me just take you through some of the consultations and agreements that have taken place to date as part of the preparation for response. The Ministry of Local Government and Community Development, led by the Honorable Desmond McKenzie, has been consulted with, he and his team. An agreement has been made for the coming major cleanup actions to be targeted to the communities that have been seen multiple cases of the private sector colleagues, private sector team on the response to Melissa is led by Senator Keith Duncan, who is leading that space. And there have been agreement as it relates to increasing water supplies to some of our health facilities that are having challenges, and also in terms of PPEs and other critical needs. NWC, portable drinking water. I have had a discussion with Minister Matthew Samuda, and he and his team are being activated. He's not in Jamaica now, but he's remotely working to ensure that both communities that are impacted as well as the health institutions are given reliable water. In fact, he indicated that they'll be getting new trucks next week, and he will have some dedicated to both hospitals as well as impacted community for clean drinking water. In terms of Minister Charles, Ministry of Labor, he also, as part of his welfare support packages, he and his team are pivoting, I think he has said so publicly, towards more cleaning distribution, cleaning equipment, water boots, gloves, appropriate gloves, and other protective gear, because what we have found, what the experts say, is that leptospirosis is more a function of the environment and the stagnant water and the spread within that environment, where many people are cleaning up and are exposing themselves, than it is at this time of our own drinking water. And so the cleanup and preparation and protection for cleaning up is very important. So local government will play a role in some distribution of things like water boots, latex gloves, goggles, masks, as well as cleaning agents and water purification tablets. This is being done in conjunction with PAHO and UNICEF. We'll be procuring some 10,000 sets of PPE gear to be distributed in communities to enable persons to take the necessary precaution as part of the response. Communication, already the health team is in the field and messages on the way in terms of persons to protect themselves, to treat water sources for safe consumption, as well as for domestic use, and to also, as I said, protect themselves as they interact within the environment as part of their own efforts for cleaning up. And those communications will take several formats. It will take town criers, it will take the health team on the ground. It will also involve some sort of signage being placed at strategic location to provide appropriate advisory. The messaging of that would be to avoid contact with floodwaters, drains, or muddy areas whenever possible. Wear protective gear such as boots and gloves during a cleanup or outdoor. Ensure that food and water are safe. Treating drinking water, discarding food that has come into contact with floodwater, and seeking medical care promptly if experiencing fever, headache, muscle pains, chills, vomiting, or jaundice, especially after recent exposure to contaminated water. We are also working with our partners, the Pan American Health Organization, the Caribbean Public Health Agency, on testing capacity to ensure that it adequately meets the needs for testing. Some 5,600 PCR tests for leptospirosis has been secured. In addition, we have some 100 point-of-care test facilities. The Chief Medical Officer will give us some more information on the clinical management, but as far as lab services are concerned, we have that in place. So it is a multi-pronged, multi-agency, all-of-government approach, but it also involves the people in these communities who we will advise through the various communication channels to protect themselves. This is a period in the aftermath of Melissa, when persons are more concerned now with cleanup and restoration of their premises, and where the significance of the flooding would have created particular exposure to solid waste coming down in the streams, backing up in the gullies, coming over into the yards, the floodwaters, the mud, the rats that would have left their holes to dry a place. Some of them would have been taken away in the water. The dead animals would also carry the bacteria. And so it's very easy to pick up the bacteria while you're doing your regular or unusual work of cleanup, which is why protective gear perhaps is the most important thing. The last time we met, I indicated to persons who were taking supplies into the affected parishes to, along with the food supplies, I think you should focus now on cleaning utensils, the water boots, the latex gloves, the masks, the cleaning agents, so that your relatives, your friends, those you are helping can protect themselves within this particular environment, within this very vulnerable period, recognizing the risks that they are taking by being out there. And listen, if you don't have a water boot and you can put a plastic bag over your shoes, then do that. Whatever it takes, just minimize the exposure, whether through conventional or unconventional methods, because we know you have to be out there, you want to be out there, but the risks are something that you need to manage carefully. So the Chief Medical Officer will remind us about the clinical management related to the illness, while Dr. Spence will address health promotion and protection, and the country head of PAHO, Mr. Ian Stein, will share on some of the international best practices. Before we hear from them, though, I'll quickly turn over to Dr. Webster Carr, who is our Chief Epidemiologist, who will give some deeper insights into the numbers and what we're seeing on the ground. Dr. Webster Carr.
Thank you, Minister. Good morning, everyone. So I'll just take you through the numbers and what those numbers mean. So leptospirosis is a treatable disease caused by a bacteria called Leptospira. It is often a mild illness, but it can be potentially serious. It looks like a lot of other infectious diseases, such as influenza, meningitis, hepatitis, and dengue. Transmission of leptospirosis occurs through exposure to water or soil contaminated with urine from infected animals, particularly rodents. Person-to-person transmission is extremely rare. Just a little bit about the lifespan of the leptospira bacteria. In fresh water, it can live almost 600 days. In wet and damp soil, up to 183 days. But in dry soil, only about 30 minutes. So as of yesterday, November 20, 2025, the National Surveillance Unit would have recorded 87 suspected, probable confirmed leptospirosis cases, of which 37 were post-Melissa. And we call in post-Melissa as starting from the 30th of October, 2025, in keeping with the shortest incubation period of leptospirosis, which is 2 days. Of these, 10 have been confirmed, 9 of which are post-Hurricane Melissa. We have had 8 suspected leptospirosis-related deaths. 6 of the 8 are post-Hurricane Melissa. So when we look at the graph for the last, from 2024 to present, we've seen that increase. We saw the increase in Hurricane Beryl, and now we are seeing an increase, a larger increase in Hurricane Melissa. The orange bar shows the confirmed cases. So some of us, it's easier to look on a table rather than a chart. And so in 2023 and up to October 2025, the range per month was between 2 and 21. But in November this year, we are already at 35. So we're going to look at post-Hurricane Melissa by parish. The 37 cases that we mentioned before, the largest number were seen in St. James, followed by St. Anne and St. Elizabeth. Parishes with deaths, St. James 2, St. Elizabeth 1, Hanover 2, Westmoreland 1, for the total of 6 deaths. We note the confirmed cases are 9. When we take it down to communities, the spread is throughout the affected parishes, with St. James having the highest number, and generally it seems in the Montego Bay area that we have the most cases reported to date. So when we look at the age group, pre-Melissa, persons in their 60s and the younger person, but post-Melissa, we have the persons in their 20s more so. And by and large, it's mostly male. So post-Melissa, the 37, 35 were male, only 2 were female. All the deaths recorded in 2025 were among men. So what do the numbers mean? There is an increased number of leptospirosis cases being observed within the last 3 weeks. That is, there's an outbreak of leptospirosis post-Hurricane Melissa. The majority of cases are in the most affected parishes. males are more affected overall. So this is a summary of what I want, of what the situation in Jamaica. Thank you.
Thank you very much, Dr. Webster Carr. I'll then turn over now to the Chief Medical Officer for her own clinical guidance on the matter. CMO.
Thank you, Minister. Good morning, everyone. Okay, so we went the last time through the clinical presentation, and we're just going to go through it again as a reminder to persons, seeing now that we have recognized that there is an increase in the cases and that we have declared that we are in an outbreak phase. So yes, we had the passage of Hurricane Melissa, and everyone knows heavy rainfall, lots of flooded areas. And these flooded pools of water have become contaminated with water, with urine and body fluids of infected animals. And of course, where it is that before Hurricane Melissa, you would have occupational exposure, meaning persons that work in farms, etc. Now everybody has the likelihood of being exposed because everybody is cleaning up and a lot of persons are in those waters. So if you have an history of exposure to flood waters and there's a history of exposure to contaminated water or soil, if you have bruises or cuts or you ingest contaminated foods, then there is a good likelihood that you could get infected with leptospirosis. And how does leptospirosis present? Majority of cases are mild flu-like illnesses, but you can have more severe presentations. It can involve the liver and the kidney, can also involve the brain, and can also involve the lungs, with bleeding in the lungs, and can lead to respiratory failure. The case definition that we're using is an acute illness with fever, headache, muscle pain, and weakness associated with any of the following symptoms or signs. And these are redness of the eye, no urine or little urine, yellowing of the eyes, cough, coughing up blood, shortness of breath, bleeding, which means you can be vomiting up blood, passing blood through the back passage, or you could be coughing up blood. And then there's irritation that occurs around the brain that can result in headaches, neck pain, and neck stiffness. Also, you can have a skin rash and an abnormal heart rhythm or even heart failure. So we said the majority of cases are mild. Some may even be asymptomatic. But the majority of persons are going to present with that mild flu-like illness, fever, headache, muscle pain, and redness of eyes, stomach pain, and diarrhea. Severe symptoms, we've spoken about these, and we have to reinforce them because, these persons should not be at home. They should be seeing their doctor, visiting the hospital. Jaundice, which is yellowing of the eyes. If their urine is dark, orange, or if you're not passing any urine, if you're having bleeding at any points, if you're having any kind of abnormal heart rhythm or shortness of breath on the background of that mild flu-like illness, which is the muscle pain, the fever, the headaches, then you should seek medical attention. Mild symptoms can be treated with paracetamol, for example, to relieve the pain. And of course, it is a bacterial infection, so antibiotics can be used to treat the infection early. And of course, oral antibiotics would be used then, but if persons develop more severe illnesses, have to be hospitalized, then they would need IV antibiotics. Persons who have kidney failure can result in having dialysis. Persons who have respiratory failure can end up having to have ventilation and other supportive care. Blood and blood products may also become necessary, and at this time I would just want to encourage persons to keep up with the donation of the blood. After Melissa, we did have an increase in the number of persons donating. We're having a little fall off now, but we just want to encourage more persons to go out and to donate, to look out for when we're having our blood drives or to visit the blood bank to give blood. So essentially, we have the conditions that exist for contamination of our waters and infection of persons. If symptoms develop, seek medical care. It is treatable. You can be treated. Also, testing capacity is available, and I would want to just say a big thank you to our partners, both PAHO and CARPHA, the Caribbean Public Health Agency, that have really worked to increase our capacity, not even starting with Melissa, but starting from before Melissa, and now we have received additional supplies that enable us to respond effectively. So treatment is available, and most cases can be treated successfully. Late presentations, which when you start having severe symptoms, that is when, if you don't seek medical attention, then you can have poor outcomes. Thank you. I'll hand over to Dr. Spence, who is going to go through prevention.
Okay.
Morning, everyone, and thank you. I'm going to briefly take us through the public health prevention strategy that the Ministry of Health and Wellness has employed to address this problem of leptospirosis. So the ministry has intensified its surveillance and prevention efforts for leptospirosis, which we just heard is a serious bacterial disease that is spread through water and soil contaminated by the urine of infected animals, especially rodents. The flooding, debris, stagnant water, and damaged sanitation systems have increased the risk of transmission, as has been demonstrated by the increase in the cases that we have identified post-Hurricane Melissa. There is widespread flooding in terms of our current risk situation and water contamination across multiple parishes. There's increased rodent activity due to the fact that they have been displaced from their normal habitats, and high-risk exposure is among cleanup crews, farmers, shelter residents, waste and vector workers, and persons wading through floodwaters. Our strategic response is based on 5 pillars: enhanced surveillance and rapid response, environmental health and vector control, protection of high-risk groups, clinical preparedness, as well as public education and community engagement. In terms of surveillance and case management, our enhanced surveillance is in high-risk parishes, which ensures that we detect our cases early so that we can act appropriately. The public health teams are conducting rapid case investigations to trace environmental sources. There is case mapping to identify potential clusters early and to act quickly, as well as prioritize testing for persons with fever and recent flood exposure. In terms of our environmental health actions, our rodent control programs have been intensified in key areas, such as baiting, trapping, and sanitation improvements to reduce infestation, coordinated with relevant authorities for drain cleaning and solid waste removal to eliminate rodent harborage and stagnant water, the distribution of chlorine tablets to households for safe water treatment, as well as continued coordination and collaboration with National Water Commission and our municipal corporations at the local level to restore chlorination in piped supplies. When it comes to the protection of high-risk groups, importantly, we need to continue to promote the use of personal protective equipment, such as the appropriate gloves and water boots, among our first responders and sanitation workers. And we also need, safety briefings for our vector control teams, our parish cleanup crew, sanitation worker, and our volunteers who are working in the most affected parishes to ensure that they are remaining compliant with wearing these PPEs. When it comes to clinical preparedness, we are having sensitization sessions for all healthcare providers to suspect leptospirosis in any patient who meets the established case definition. We do have adequate stock of antibiotics and other items that we need to treat leptospirosis cases that have been identified at all our health facilities. And certainly our referral pathways have been strengthened for severe cases, including those who present with jaundice, kidney failure, and/or bleeding. In terms of our public education and risk communication and community engagement actions, this is a multi-pronged approach. So public education campaigns via radio, TV, social media. We're also using town criers as well as community outreach sessions. Our key messages include avoid wading in flood water and mud, using boots and gloves during cleanup, store food safely and make sure our containers are appropriately covered, washing our hands and disinfect frequently. In terms of community engagement, we participate in health fairs, farm visits, etc., so that we are able to do one-on-one sessions with the community that we are having these interventions in. And of course, we can't do this all by ourselves, so there is collaboration with RADA, Jamaica Agricultural Society, as well as other agencies through ODPEM to ensure that we're reaching our rural farmers as well as our cleanup volunteers. Our community engagement approach includes partnership with faith-based organizations, our community leaders, civil society organizations, and volunteers. There is collaboration with UNICEF, PAHO, and ODPEM, as well as our municipal authorities for outreach and the provision of supplies. And we are also collaborating to have community cleanup drives to remove debris and rodent breeding sites. So just a few key reminders for the public. Leptospirosis, while it can be severe, is preventable and treatable as well. Early treatment is highly effective. And so we should not ignore, our signs and symptoms and seek medical care early. Community participation in cleanup and rodent control is essential, but we have to ensure that we're using the appropriate personal protective equipment, such as our appropriate gloves and water boots. We need to make sure that we are protecting our children and the elderly and persons with chronic illnesses, as they are more vulnerable to severe disease. And we also need to make sure that we're reducing the debris pile and high vegetation, which is harborage for rodents, and so, puts persons at high risk for contracting leptospirosis. Thank you.
Thank you very much, Dr. Spence. So at this time, I'm going to ask our international partner or multilateral partner, Ian Stein, country rep for the Pan American Health Organization, who is with us and has been a critical part of our Melissa response with the support, both in kind and with other supplies and technical support, to just comment on the approach and any other suggestions for the public. Thank you. Ian?
Thank you and good morning. So on behalf of the Pan American Health Organization and the World Health Organization, I need to commend the Minister and the Ministry of Health and Wellness for this decisive and transparent action in declaring an outbreak of leptospirosis. This announcement, as Dr. Tufton had outlined, reflects not only the seriousness with which the government of Jamaica approaches public health, but also its commitment to openness to the people of Jamaica and within the global health community. We often focus on a hurricane's immediate path,
and rightly so, as its impact can be devastating. Yet in public health, we know that the aftermath can pose equally serious risks, particularly the threat of emerging diseases that tend to follow major storms. Our ability to respond quickly depends on how rapidly information flows from affected areas, how promptly epidemiological teams can detect unusual patterns, and how swiftly
that data. Leptospirosis is one of those threats we unfortunately have to face in the aftermath of Hurricane Melissa. Our heartfelt sympathies go out to all those impacted by this outbreak. We stand by the affected families and the communities during this difficult time. We strongly encourage everyone to follow the guidance that the Ministry of Health and Wellness has provided as these measures are following the best international practices and are essential to controlling the outbreak and protecting your health and your community's health. Since Hurricane Melissa, the ministry has acted quickly to inform the public about disease prevention, sharing clear guidance on avoiding floodwaters, using protective footwear when it is necessary to traverse floodwaters, protecting food and water supplies, and seeking care if symptoms arise. At the same time, surveillance has been strengthened to detect suspected cases of leptospirosis and other post-disaster diseases. Timely investigations are underway, supported by enhanced laboratory capacity that enables rapid testing and early intervention. These actions allow health teams to act quickly and save lives. I want to recognize the dedication of Jamaica's health professionals. Their expertise, their compassion, and their tireless work in hospitals, clinics, and communities across the island give us confidence that those affected are receiving the best possible care. The ministry's timely and transparent communication with the public further builds trust, ensures people that have information they need to protect themselves, and reaffirms Jamaica's leadership in upholding global health security commitments. The actions taken so far, clear communication, stronger surveillance, rapid testing, transparent reporting, align fully with PAHO and WHO's recommendations. They show that Jamaica is protecting its people while contributing to regional and global health security. I want to highlight this time just briefly some of the work that PAHO is doing to provide Jamaica and some support during this response. We are working, of course, very closely with the Ministry of Health and Wellness to provide supplemental technical guidance on reinforcing surveillance, laboratory diagnostics, and case management. We've supplied essential laboratory reagents to ensure rapid confirmation of cases. PAHO is supporting the Ministry of Health's training for health workers on early detection of leptospirosis, clinical management, and infection prevention. Together with partners such as UNICEF, we're collaborating with the Ministry of Health and Wellness to expand the reach of public health messages, ensuring that communities receive clear, practical information about prevention, especially in flood-affected areas. As PAHO and UNICEF are both coordinating with the regional and international partners to mobilize additional supplies, additional protective equipment, and additional technical expertise. And lastly, in this area, we're sharing the lessons learned in Jamaica across the Caribbean to support regional preparedness and resilience. PAHO and WHO reaffirms our full support to the people of Jamaica, the government, and the Ministry of Health and Wellness. We stand ready to provide technical assistance, resources, and collaboration whenever needed. Together, we continue to strengthen Jamaica's resilience to health threats, protect lives, and uphold the principles of transparency, solidarity, and partnership that lie at the heart of global health. Thank you.
Thank you very much, Ian. So there you have it, ladies and gentlemen. Leptospirosis, I think the important messaging here is that it is preventable, it is treatable, and it is survivable. So that's the positive on what is an unfortunate situation. The key is detected early and taken seriously. So the symptoms of this, as described, are important for persons to note. And then to avoid altogether, I think the greatest risk right now is the stagnant water, the solid waste in the communities, and combined, of course, with the rodents and other carcasses or animals, livestock that would be infected, and how that contaminates the environment, your water, your food, and otherwise. So it's so important for Jamaicans to take particular care at this point to avoid it. Now, you know, it's expected. Indeed, if you look at the history of leptospirosis, even with Melissa, there was a spike in the numbers. So you expect this kind of risk to be at a greater level of elevation after an event. This is our first episode with a Category 5 storm. It's been devastating. It has flooded out many areas. So the health authorities, in a sense, had started planning before we got to this point, recognizing that we would see increased risks. So it's not unusual. It's not something that we should panic about. It's not a call to panic. It's really a call to action for prevention in the first instance, knowledge maybe in the first instance, prevention in the second instance, and of course treatment thirdly if those symptoms should arise. And so I urge the country, the population, on behalf of the Jamaican government to see this as an advisory for collaboration and not as a cause to be scared or to panic or to feel that there is no hope, because there is hope. This is about delivering solutions to the problems that we have. It is in keeping with the post-hurricane approach from health and indeed from the government. And it is about trying to engage all of society to be a part of that solution as we seek to clean up and to build back stronger. My condolences too to the family members of the deceased and to those who are currently confronting the virus. The hospital system is ready and able to treat with them. We have the medicines, the antibiotics, we have the doctors who are going to be further refreshed about symptoms and treatment. As a matter of fact, this afternoon in a training session, both public and private sector physicians, and we have the support systems, whether it is the public health inspectors on the ground, the supporting agencies of other government ministries, the private sector, and of course you heard from PAHO a short while ago. So it's an all hands on deck approach, and we will pull through this. Things will get better. We ask that all just conform to the approach and help us to work this through. Thank you very much, and I hand back now to our moderator, Stephen.
All right, thank you very much, Minister. Thank you, team. So we're going to allow our media colleagues on the Zoom to pose any questions that they may have to our minister and our team. And please use the raise hand feature on Zoom to pose your question. If you have a question for our minister or a member of another member of the team, you can use the raised hand feature on Zoom to ask your questions. All right, I'm not seeing any raised hands, so I think our media colleagues are clear on the information. So, Minister, I'm going to turn back to you to give your closing remarks.
Well, I think I've said it. I see one hand up, Stephen. Mahira Stewart, sorry. You wanna take that question?
Sure. Mahira, can you just identify which media house you're from, and you can go ahead with your question. Mahira, you hearing us? Or you can put your question in the chat if you're unable to speak. Okay, Mahira is from Nationwide, and she is asking, is there any heightened concern for persons in places suffering from rising waters, such as content in Manchester? So the question from go ahead, Minister.
I perhaps the clinicians can take that. I mean, it seems to me that water and flooding is a conduit for the bacteria based on solid waste and exposure to the carriers of the bacteria. So rodents, or other forms of animals and livestock, dogs, cats, and so on, that may have the virus. So what water does, and again, this is my layman's interpretation, Dr. Seymour can come in after. Water actually moves the bacteria or the carriers of the bacteria So whether it's the urine or otherwise, and that water becomes a critical thing, which is why we say, to the extent that you have to work in water in a damp place. You heard Dr. Webster Caro, epidemiologist, says the bacteria perishes relatively quickly in dry areas. So sunning out or exposing your homes or personal possession to drying out after a storm, or not overly exposing yourself to water, is a mitigation measure against the risks. So wherever that water is, you would have seen that the spread across the country takes in parishes as far as St. Mary. So and St. Catherine, actually, because the rain fell right across the country, even though the hurricane and the impact of the wind was confined more to 5 parishes. The entire country had rain, and anywhere there's a lot of rain, the rodents that would have a dry place or seek a dry place would move from wet to dry and take with them all the negatives that would create this bacteria from spreading. But Simo, maybe you want to come in there and add some of your own technical skills to this question.
Well, Minister, you did a very good job of responding to the query. So I would just add, this is Dr. Spence, by the way, that in terms of anywhere where water is rising and there is flood water, there is an increased risk and potential for infection with leptospirosis, especially if persons are wading in flood water and they have cuts or bruises on the skin. It can get in through the eyes, the nose, the mouth, because the mucous membranes is also another access point. And, if we're using non-potable water, meaning water that has not been treated either by boiling or chlorinating that water, and brushing our teeth, cooking, and doing those domestic things, then also it puts you at potential risk. And so we just need to continue to follow the precautions as we have given them in terms of wearing personal protective equipment as you're cleaning up. So your appropriate gloves, not the latex gloves that we use when we're doing procedures, but persons would know about those nice yellow kitchen gloves or bigger industrial gloves, the thick ones, as well as your water boots. If you have access or they're available to you. If not, putting on plastic over your feet if you have to be in the mud and in the flood waters while you're cleaning up. Thank you.
Thank you, Dr. Spence. Thank you, Minister. So a final chance for our media colleagues to, if there are any other questions. Then we'll just hand over. Mahira, you have a follow-up question? If you have a follow-up, you can put it in the chat.
Hello?
Yes, we're hearing you.
Nice. Good morning, everybody. Mahir Stewart, Nationwide News here. I know that this press briefing has been covering leptospirosis. In terms of other waterborne illnesses or illnesses you can contract from contaminated water, such as maybe gastroenteritis or cholera, is there any update you can give on those diseases and whether or not there have been any suspected or confirmed cases of those?
So to be very clear, we don't have cholera in Jamaica. We don't have cholera in Jamaica. It would have to be brought here. With respect to the other gastroenteritis, we are not seeing at this time an increase above the normal. Okay, so at this time, we are not in an outbreak for gastroenteritis or waterborne illnesses.
All right. Thank you very much, Dr. Webster-Carr. All right, so I'm going to hand to the Minister now to give his closing remarks.
All right, I just want to make one appeal to the public beyond what has been said, that the communication with the persons who are most exposed is a bit challenging beyond what we have to do, kind of unconventional town crier, signage, word of mouth through the public health team who are out in the field. I know we're all, a Jamaican somewhere outside of the ground zero is in touch with someone in ground zero, whether through their Starlink communication or working floor digital signal, or through personal contact by visitation on a weekend or otherwise. So important that we exercise the power that we have of information to support those persons in those communities. And I want to just make a special appeal. Please speak to the people that you're in touch with, help them to understand the importance of what needs to be done. There is a lot of complexity around the state of mind of individuals in the zone. They are busy trying to prepare their roof, to clean up their yards. They don't have time to listen to the radio. They aren't able to listen to the radio or television. They may be mental wise not in the right mood or the place to listen to anything that is electronic or town crier. They may only be listening to those who they have some sort of confidence in or offering them some comfort. We need to communicate with our friends, our family, our members in that space, recognizing their own space and the challenges that they face. So the protective gear, very important. So this weekend when you're going down, buy a pair of water boots, find out the sizes, buy some gloves, take that instead of the food, or at least share it 50-50. It's a good appeal because one of the things the epidemiologists will tell you, Dr. Webster Carr and others, is that to the extent that we have identified some members who are positive, there are multiple others who may be carrying the virus because of the way it is spread. In some instances, most instances maybe, persons recover naturally, but of course, the severe cases end up in the hospital and without treatment could have the extreme negative effect. So there are more cases out there than actually detected. It's like COVID. For every one you detect, there may be 5 or 6 others in the environment. So we can't treat it lightly, and we have to get each other to work with, each of us to work with others we know and offer them some support and protection as it relates to the risk within the wider environment. So thank you for that, and we will continue to keep the public updated on the matter. God bless. Thank you. Over to you, Stephen.
Do you recognize the signs of dengue? Look out for these symptoms: high fever, severe headaches, joint and muscle pain, skin rash, nausea, and pain behind the eyes. If you experience these symptoms, rest, stay hydrated, and take paracetamol for pain relief. If symptoms persist beyond 3 days or worsen, such as persistent vomiting, severe abdominal pain, or difficulty breathing, seek medical attention immediately. Early treatment can save lives. Know the signs, act fast. Together we can beat dengue. This message is brought to you by the Ministry of Health and Wellness and PAHO.